In gynecology, Cusco's self-retaining bivalve speculum is a kind of speculums used for vaginal and cervical examinations. It has a jaw that open up like a duckbill. It comes in the three models: side screw, center screw and special narrow virgin size. Cusco speculum used for introducing an intrauterine contraceptive device, taking a pap smear, cauterization of vaginal erosion, and colposcopic examination. It is preferred in cryosurgery because it protects the anterior and posterior vaginal wall. The advantages of Cusco speculum is that it is self-retaining. Therefore, an assistance, not help, is needed to keep the speculum in place. It also acts as a vaginal wall retractor. However, it reduces the space in the vaginal cavity and therefore is not a preferred instrument for vaginal surgery because it comes most of the vaginal wall. Small lesions on the vaginal wall may be masked by the blade of the device. The uterine sound. The uterine sound is used to gauge the depth and position of the uterine cavity. It is also helpful with the placement of intrauterine device and the verification of intrauterine position and length for hysterosalpingography procedure. Anterior vaginal wall retractor. Anterior vaginal wall retractor is used on the posterior vaginal wall to isolate the visualization of the anterior vaginal wall. This fusion craft seams anterior vaginal wall depressor is required to complete bimanual examination of the anterior wall of the vagina to check any pelvic abnormalities. Vulsellum. Vulsellum forceps are used in obstetrics and gynecology. Each pair of surgical forceps has hook at the tip of each blade and are used to grab the uterus or cervix during procedures. Vulsellum forceps are used for grabs cervix or uterus during procedures such as episiotomy, hysterectomy, or dilatation and curates. Vulsellum forceps have hooks at the tip of each blade and are often used in obstetric and gynecological procedures. Sponge holding forceps. A sponge holding forceps or a sponge forceps, as they may be called, are instruments which are used by doctors to hold on to sponges and or swab while conducting their medical procedures. Sponge holding forceps are usually made in the shape of scissors. The jaw of this forceps can either be serrated or they may be smooth. The handles are retouched as well as looped. Sponge holding forceps can either be curved or they may be straight. The shape is different for each individual purpose for which they may be used. Sims vaginal speculum. In gynecology, Sims vaginal speculum is double-bladed surgical instrument used for examination the vagina and cervix. It was developed by J. Marion Sims out of pivot spoon, but nowadays it is manufactured out of stainless steel or plastic. The plastic speculum is disposable, but the stainless steel one is not. Therefore, the stainless steel speculum should be sterilized before each use. Since speculum is inserted into vagina to retract posterior vaginal wall, it gives more exposure of the vaginal wall than Cusco speculum and therefore is preferred for gynecological surgeries. It is possible to slide the instrument around the vaginal wall to enable better visualization. The groove in the middle of seam speculum allows free flow of secretions and blood to the outside, thereby keeping the area dry. Seam speculum is available in various sizes and the size appropriate to the vaginal dimension of the woman's chosen for use. The disadvantage of seam speculum is that it is not self-retaining. The examiner might want to use an anterior wall retractor in addition to seam speculum for better visualization of cervix. A needle holder. Needle holder, also called needle driver or needle forcep. Needle forcep is a surgical instrument similar to a hemostat used by doctor and surgeon to hold and push a suturing needle when performing wound closure, ligation and other surgical procedures that require reanastomosis. Being specialized forceps, the component of typically needle holder as the jaw, the hinge joint and the handles. Most needle holders also have a ratchet mechanism that lock the handles together and clamp the needle firmly between the jaws, allowing the user to maneuver the needle through various tissue without having to keep squeezing the grip. To maintain a firm grip on the needle, the jaws are often textured and short compared to the handles, increasing the mechanism advantage using the principle of a lever. Episiotomy scissors. Episiotomy scissors are angled scissors. An incision is made using episiotomy scissors to the perineum, the muscles between the vagina and rectum, to widen the vaginal canal for delivery. The sterilization process kills any type of germs and bacteria and make this safe for use. An Allis clamp. An Allis clamp, also called the Allis Forceps. Allis Forceps is commonly used surgical instrument. It was invented by Oscar Allis. The Allis clamp is a surgical instrument with a sharp teeth used to hold or grasp heavy tissue. It is also used to grasp fascia and soft tissue such as breast or bowel tissue. Allis clamps can cause damage, so they are often used in tissue about to be removed. When used to grasp the cervix to stabilize the uterus, such as when an intrauterine device is being inserted, an Allis clamp has the advantage of causing less bleeding than the more commonly used tenaculum. Artery forceps. Artery forceps are an instrument used to control bleeding for blood vessels by clamping the artery, a process known as hemostasis. They feature a locking mechanism at the top of the forceps to secure them in place during procedure. Tooth forceps. Their primary purpose is to grasp, retract, or stabilize tissue. They may also be used to pack or extract sponges, pass ligatures, and stabilize and manipulate needle during suturing. Forceps are categorized by the presence and type of teeth that are designed for specific tissue they are intended to hold. Used for grasping and holding tissues, muscles, or skin surrounding a wound. Single tooth on one side, fit between two teeth on other side. Available as a 1 by 2 or 2 by 3 or 3 by 4. Thumb forceps. Thumb forceps are used to hold tissue still when applying sutures, to gently move tissue out of the way during exploratory surgery and to access confined cavities that are hard to reach with hands and fingers. Thumb forceps can have smooth tips, cross hatched tips, or serrated tips, often called mouse's teeth. Thumb forceps are used to manipulation and grasping of tissues during surgery. They are non-locking, they contain a grasping surface and may not have teeth. Stitch removal scissors. Stitch removal scissors are primarily used for suture removal. These scissors have a small hook-shaped tip on one blade that slide under suture to slightly lift them before cutting for removal. This hook also holds the suture so it does not slip off the blade of the scissor prior to cutting. Autoclave tape. Autoclave tape is an adhesive tape used in autoclaving to indicate whether a specific temperature has been reached. Autoclave tape work by changing color after exposure to temperature commonly used in sterilization procedure, typically 120 121 centigrade in a steam autoclave. Small strips of the tape are applied to the item before they are placed into the autoclave. The tape is similar to masking tape but is slightly more adhesive to allow it under the hot, moist condition of the autoclave. One such tape has diagonal marking containing an ink which changes color, usually being or blue or to black upon heating. It is important to note that the presence of autoclave tape that has changed color on an item does not ensure that the product is sterilized, as the tape will change color upon exposure only. For steam sterilization to occur, the entire item must completely reach and maintain 121 centigrade for 15 to 20 minutes with proper steam exposure to ensure sterilization.